happy to welcome you all today to our Doctors in program for this month. The topic we're focusing on today is going to be falls prevention. So for those of you who don't know, we do these Doctors in programs every month as a partnership between the LGBT Elder Initiative and the Jefferson Department of Family and Community Medicine. So bringing in Jefferson geriatricians and fellows to present on relevant health topics. Give a lot of time for questions. We try to put these together based on feedback from you all who are coming to our programs. So at the end on your evaluations, do let us know what topics you want to learn more about. We try to alternate each month, so some of them being here in various rooms at Jefferson, some of them being over at the William Wade Community Center, over at 13th and Spruce. So our October one, and I'll talk a little bit more about that at the end, we'll be back at William Wade for that. As long as we got your information when you came in, you'll get all the details for that program. It's going to be October 17th, though. So today, I won't take any more time, but want to introduce Dr. Bruce Reeves. He's a geriatric fellow here at Jefferson, and he's going to be walking us through today's program. So please give a nice welcome to Dr. Reeves.
So, hi all, I'm a new fellow here at Geriatrics, and today our topic is falls in the elderly. So our objectives of the day are to know and understand the importance of falls in older people, the prevalence of falls in this population, some causes of falls, ways to prevent these falls, and how to help yourself and those you love in regards to falls prevention and education. So just to talk a little bit, what is geriatrics? So in general, it's a specialty dedicated to the care of the elderly, and we normally define that as people age 65 and older, although in our practice we definitely see a lot of complicated people who are 55 and older, and some people even younger than that. So a little bit of epidemiology and why everyone here is so important. In 2010, there were 524 million people over the age of 65, and that represented 7% of the population. This is expected to increase by 50% by 2050. This will represent about 1.5 billion people. So clearly, there will be a lot of people aging, and I thought this was also interesting. So since the beginning of time, basically, those under age 5 represented more in the population, but now, as of literally right now, there are more people over the age of 65 than age under 5, and this just represents falling rates of fertility, as well as just people living longer and longer. The life expectancies have increased. So, first question of the day. What is one of the most common events threatening the independence of older adults? And I will give you a hint. It's today's topic. Yes. So falls, yeah. So the definition of falls is coming to rest inadvertently on the ground at or at a lower level. It's very soft, nice. That is a fall. Most falls are not associated with syncope or trauma, and falls literature usually excludes falls associated with loss of consciousness for this reason. So older adult falls, 1 in 4 older adults reported a fall in 2014. And more than 7 million of those falls required medical treatment or restriction of activity for at least a day. And more than 27,000 older adults died as a result of falls. And that represents 74 older adults every day. So clearly this affects us very greatly. So every second, an older adult falls every second of every day. And 1 in 4, like we said, reported a fall in 2014. And it's the #1 cause of hip fractures. And although 1 in 4 adults reported a fall in 2014, only half reported this to their doctors. So why do you think people don't? And this is, I really don't know. Why wouldn't people report that to their doctors?
They may not think they're injured enough.
They're embarrassed, true. Yeah. So maybe after this lecture or this talk, you can think of some more answers. So falls are very common, and the rate of falling rises to about 50% for those ages 80 and older, and at least 2/3 of nursing home residents fall each year. And this just represents the death rates leading mechanisms of injury among persons 60 ages or older in the US. So basically we kind of see for 60 and older, the second line represents motor vehicle accidents, and that's a leading mechanism of injury. But then right when we get to over 74, falls kind of shoots up. And then by the time we get to 80, it just literally just goes almost straight up. So we go from motor vehicle accidents to falls affecting the older population. And as far as morbidity and mortality, most falls by older adults results in some type of injury, and 10 to 25% of falls result in a major injury like a hip fracture or traumatic brain injury. And greater than 95% of hip fractures are associated with falls. And about 20 to 30% of older hip fracture patients die within 1 year. Very sad. Only about 50% of community older adults who sustain a hip fracture recover to their pre-injury walking capabilities. And then falls are also very expensive, not only to the patient, but to our healthcare system in general. We have increased ED visits and hospitalizations. In 2012, direct medical costs exceeded $30 billion, and total costs are projected to reach $55 billion by 2020. So definitely very expensive. So another question. Falling once blinks your chances of falling again. A, does not affect your chances. B, halves your chances. C, doubles, or D, triples. What do you think it is? C. C, doubles. B, C, D. B, C, D, A, B. So actually doubles your chances of falling again in your lifetime. Yeah. Yeah. Okay, kind of scary. Yeah, see? So, am I at risk for a fall? So your risk of falling increases as you grow older, and the effects of falling are also more serious as you age. So what are some of the risk factors? And generally, we divide these into non-modifiable and potentially modifiable risk factors. So some non-modifiable risk factors for falls include things that you can't change. So like age. Can anybody think of some things that you can't change about yourself or your situation that might affect your likelihood of falling?
Our bones lose that, like when we was younger, our bones is more brittle.
Mm-hmm, more brittle, less dense. Anything else? Let's see what else in there. Cognitive impairment or dementia. People with dementia are more likely to fall. Previous falls, as we said before, doubles. History of a stroke.
Do you think people with hearing impairment sometimes fall?
Mm-hmm. That definitely does affect you, and that could be kind of put in more the modifiable risk factor, so I will throw that over there. So recent discharges from hospital, so it's found that if you were discharged from a hospital within 1 month, you're more likely to fall. And then dependence in ADLs. And ADLs are activities of daily living. They're basically activities that you do every single day. You're taught when you're little, things like feeding, grooming, bathing. So if you're more dependent on those things, then you're probably more likely to fall.
What do you mean dependent?
Dependent as in having someone help you, like people in nursing homes, people who have home health aides. Yeah, that's what I mean by dependent. So some potentially modifiable risk factors for falls. So these are the things that we can kind of change when you go to your doctor's office, when you're sitting there thinking like, how can I help myself not fall? So medications, certain medications can make you a little more drowsy, make you more likely to fall. Some of them can be like psychoactive also. Some neuropsychological factors such as delirium and depression, dizziness, vertigo, a fear of falling can make you more likely to fall. Peripheral neuropathy, if you can't really feel your toes, feel your feet, you don't really know what's going on below. If you don't look, you can trip and fall. And then musculoskeletal factors such as gait or balance impairment, lower extremity muscle weakness, foot problems, musculoskeletal pain, use of assisted devices such as a cane or a walker, and inappropriate footwear. A lot of times at home we just put on the slippers that we might have had for like 17 years and they have like no sole, and the next thing you trip and fall.
But also, if you're not used to a cane, you will trip and fall.
That's very, very true. So we know, okay. Lesson learned. Anything else? Okay. Perfect. And so to go more with that, the use of assistive devices, let's talk about cane. What is the correct height of a cane or walker? A, elbow, B, wrist crease, C, iliac crest, basically your hip, or D, umbilicus, which is your belly button.
Big.
I don't know how to explain it, but they tell you when you stand up and it has to be underneath your hand.
Mm-hmm.
So whatever way you
Uh-huh. Yeah, you can kind of see that if you're like underneath your hand, my little wrist crease maybe. Okay, so well, seems like we like that answer, so let's see. Yay, we got it right, wrist crease. So, more specifically, your cane height can be, you can get that by dividing your individual height by 2, put it in inches, dividing by 2, and then minusing it by 1. And that gives you the literal perfect cane height. So, I like math and I like examples. So, pop quiz. This is Mary. She's your friend. She's 5 feet tall. What is the correct height that her cane should be based on the equation that I just gave you? So think about it.
2.5 inches.
Yeah.
2.5 inches.
Maybe.
minus 1 inch.
Yeah, you have to do math today.
Yeah. Should have told you to bring your calculators.
29.
I'm 5 feet tall and that cane is a little too.
See, so if we need to fit you afterwards, you can just stay and we can help you out. So, again, we're going to divide her height by 2, minus an inch. So in general, she's 5 feet. That equals 60 inches. And I got that by doing 5 feet times 12. And then we do half of that. So inches is 30 inches, then 30 minus 1. So her cane should be 29 inches tall, which almost seems a little short, but that's her perfect height. So yours is 29 inches? Oh, okay, so you good. You passed. You and Mary, we good. So, and her cane clearly is a little too tall, so Mary girl, we gotta help you out. I'll call her afterwards. All right, so some more potentially modifiable risk factors for falls. Sensory impairment, as you mentioned, so auditory and visual impairment. So if you can't hear, if you can't see, definitely if you need to get your eyes checked. Multifocal lens use, if you have like bifocals or multifocals where you kind of have to have it one way to read and another to see far, that can get confusing. You can get dizzy. Environmental hazards such as your house, other things such as alcohol can of course make anybody more likely to fall. A low BMI, a vitamin D deficiency.
What is BMI?
Body mass index. Chronic conditions such as arthritis, diabetes, strokes, urinary incontinence, Parkinson's disease, because they're known to be more shaky, more likely to fall. They're going to have a shuffling gait. And orthostatic hypotension, which means you have low blood pressure. And then some acute conditions like dehydration and anemia and arrhythmias, meaning you have heart palpitations.
By any chance, do they know where low blood pressure comes from?
Yeah, it can come from many factors for different people. It can come from different things in your body that's not regulated correctly. It could come from dehydration. Be something that your doctor would just have to, in your body, like thyroid issues, different things. So we need you to drink lots of water, walk around your 29-inch cane, and you'll be good. Same height as Mary. So, to talk about some environmental hazards. So, this is Mary's home. It actually looks like my house too, but she needs some help. So, what are some things, some things that you see that could make Miss Mary, who's watching The Price is Right on TV? The steps. Say that again. The rug, the rug is definitely, she needs the wires and cords.
The blender.
Blender?
She needs a rail to hold on.
She has no rail. She can literally just fall right over. I had a patient that happened too. Not pretty. Some other things, her pet, like her cat's running around. If she messing with the cords, you can trip over pets. We kind of see her medicine cabinet. It's a lot of meds in there, and and they might have some potential interactions. And I also see some cobwebs in there, so I don't even know if they're like, if she's supposed to be taking them. I see her glasses are on the table, so maybe she can't see.
Is that a cigarette?
It's a cigarette. It's lit. It's about to fall off. And on top of that, we look up on the ceiling, and I don't even know if her fire alarm has a battery. I don't think that'll make her fall, but it could scare her. She could try to run out. It's not gonna happen. I like her slippers, but I don't know how safe they are if she's unstable. She got medication all over the place. We even look at her heater, and she has a little something sheet over top of the heater, even though it's so.
Ashtray and her, what's that, a dress she got over there?
Yeah.
Is that her, or is that somebody that's supposed to help her?
Oh, maybe it might be her aide. I don't know. Her daughter. Yeah, we can write our own story. Done.
She hasn't been paying attention to, maybe it's starting to build.
Mm-hmm. That's what I'm thinking. So, if this was somebody we love, we could think about some of the things that we learned so far and some of the things that we will know to kind of help Miss Mary, last longer and not fall. So, what can I do? Things you can do for yourself or someone at risk. Like we said, you can wear sturdy or non-slip shoes that fit well. You can take vitamin D pills. The vitamin D pills will make your bones stronger, make your muscles stronger, and that will make you less likely to fall. Milk is very good. Tastes good too. You can stay active and exercise. Tai Chi is something we definitely recommend. It's like a very slow, I've actually never done it before, so I don't know if that motion was real Tai Chi, but it felt Tai Chi. You can use that cane walker assistive device. And by assistive devices, I also mean like the railing on the stairs. If you need railing in your bathroom, kind of getting in and out of the tub, that is also something that the doctor can order for you. You want to clean the house of clutter, as we saw before, make the dwelling safer, using the non-slip rugs, make sure it's well lit. I don't even remember seeing if I guess she had some lamps, but avoid storing things in high places, because of course if we're in the kitchen or in storage and we have to pull out a stool or a ladder, we're more likely to reach up and slip and fall, which is not good, especially for people, elderly people. So alarms is another thing that we can talk about. So if you worry that you could fall, there are also alarm buttons that you can call for help if you can't get up. So basically it's a two-way calling system. I've seen it either go directly to like 911 or dispatcher or third party, or sometimes it'll just go towards someone you love if you want to put their number on it. And it can come in the form of just something on the wall, something on a table. It can be a necklace, it can be a bracelet. Some of them are actually really fashionable if that's your thing. And basically if you fall or think you're about to fall or even having a seizure, anything, you can just push it, it'll alert the medical alert squad, and they will contact you, and then you hear a little voice in your necklace or on your wrist, and they'll say like, what's wrong? Do you need help? And you go, yes. We've all seen that Life Alert little commercial when they're like, I've fallen and I can't get up. That's basically what this is. And in order to get this, you can go on different websites. You can Google it. You can talk to your primary care doctor or your geriatrician, and they can get you into contact and where you can get these things. They're like different prices. And then what do I do if I fall? So see your doctor right away, even if you aren't hurt. And as we said earlier, although 1 in 4 people fell in 2014, 1 in 4 adults, only half of them told their PCP. And then they can help you find the cause. They can do an exam as well as talk about medications and problems and activities that you can do to prevent further falls. So no matter what, whether you think you're hurt, just go ahead and make that appointment and go and see them. We'd like to see y'all. So exam. There are many exams out there for you to do in the doctor's office, but one that we do a lot is the get up and go. So this is a cartoon. I thought it was funny. So the timed get up and go test, or the TUG, is basically a test to test your mobility while you're in the office. So basically what you do is you get up out of a standard chair, you walk 9 feet, you turn and you walk back, get in the chair and sit back down. It's a very easy test. 9 feet would be about here to like right in the middle of the room, or like here to like where Beth or Mariana is. So in this, you can also use your assistive device. We basically want to see how you are out there in the world. So if you normally walk with a walker or a cane, we like you to use this while you're doing this get up and go test. So what do you think is a normal amount of time for you to do this time get up and go? For you to get up out of your chair, walk your 9 feet, turn around, come back, sit down. 2 minutes? 5 minutes? 20 seconds? All right, got a nice range. Anything else? 3 hours, 1 second? Good? 5 minutes? 5 minutes?
5 minutes.
All right. 1 minute? Does anyone want to try the timed get up and go test? Yeah, all right, got a nice fit, man. Come on up here. So I want you to sit here. Perfect. And what I want you to do is 9 feet, I would say, see his black shoe, or right where they are? I just want you to get up, walk there quickly, but don't run, and then come back around. And I will tell you when to go because I'm going to time you, and we'll see if this takes 2 minutes, 5 minutes, 20 seconds. All right, so I'm ready to go whenever you are. 3, 2, 1. Perfect. So that was 8 seconds. So that was perfect. So a normal time, if you're freely mobile, is less than 10 seconds. And I honestly feel like if I told you to go faster, you probably could. Normal is between 7 and 10 seconds. If you're over 12 seconds, then it's associated with an increased risk of falling. And if you're more than 20 seconds, it's associated with a more severe gait impairment. So we were a little off, but it's okay. We're here to learn. So an element that we will observe as physicians is you're getting up from the chair. Like, do you have to use the railing on the side of the chair? Do you have to scoot off? Can you even get up? Sitting down back on the chair when you get up. Do you just plop down? Do you trip? Gait initiation, like, do you have to put up your gait? Do you have to put up your feet, your step height, your step continuity? Do you start fast and slow up? Your step symmetry, how symmetric it is, like if you're limping, if you hurt your foot, your path deviation. Some people might walk and kind of go more towards one side or towards the other. And then at the end we had to turn. That also takes a lot of coordination, so we observe all this to kind of see what we can do to help you not fall. Pop quiz. A cane should be held ipsilateral, so on the same side to a weak or painful leg. So I just hit my leg, I'm gonna go to CVS, go to a nice store, buy a cane. Where should I put my cane? Should it be on the same side or the opposite side? Okay. Same, opposite? Okay, I'm taking it all in. I got about like 70% of you saying opposite, 30% saying same. The answer is false. Yeah. So you should actually have it on the opposite side, and you should generally advance it at the same time. Basically, you're supposed to see your primary care doctor or physical therapist, and they'll kind of show you how. But a lot of us, like I said, just go to CVS, find that girlfriend, find that boyfriend who has an old cane. I've even seen people use a stick from the backyard, and it's just like, I'm gonna make this work. But you definitely want to make sure you know how to use it.
You're in trouble when both sides are messed up. So you're
It's true.
That was me. I got both sides.
Mm-hmm.
It's like on this side I use it a little bit, on that side.
Mm-hmm. So in that case, maybe we wouldn't have you in a cane. We might have you in another type of device, maybe a scooter or a wheelchair or something fancier. Yeah. Give you the cane, the double canes. That's fine. You can go in giraffe mode. All right, so resources for you. So there's some resources, and we have some here too, but stopfalls.org had a lot of different resources in it. Philadelphia Center Corporation of the Aging, which is pcares.org, has a lot of resources. They can show you where you can get the life alert. They can show you Things you can do. They have different senior centers. Aging.pa.gov also has a list of senior centers that we could go to, and then NCOA.org, the National Center for Aging, is also a really good site that shows different resources for you guys. So in general, falls are very common and cause significant morbidity and mortality, are costly and often preventable. Falls result from multiple interacting conditions and risk factors. Identifying and targeting risk factors can reduce falls, and always tell your doctor when you've fallen, no matter what, and encourage your friends to do it too. So, thank you. Any questions? Yeah, no, that's good. That'll be good. And then I also have some little resources, but that's really it. Oh, sorry, missed you.
What else has vitamin D?
What else has vitamin D? That's a good question.
The sun.
Yeah, sun is a great resource. That's probably one of the best ones. Juice definitely does. Yogurt, any kind of like dairy. Yeah, a lot of things are fortified with like vitamin D and other vitamins and minerals as of right now. Fish definitely, yeah. Fish and meat.
The best way to get vitamin D, though, is from the sun.
Mm-hmm.
That's the best way. Or sometimes your doctor will tell you to take vitamin D pills over the counter.
Mm-hmm. Mm-hmm. Yeah.
Yeah. But the sun. That's the best way. Yeah. But wear sunscreen. Not too much.
Oh, sunscreen. That's something you can have with vitamin D, or with that not very helpful.
That could be very helpful too, and definitely something you could have. And he asked about calcium, and calcium and vitamin D kind of go hand in hand. Calcium more for your bones, and definitely having strong bones will help you from falling, or if you do fall, make you less likely to break or fracture.
The most important is the vitamin D, even more than the calcium. Not everybody needs to take calcium. Some people do because of the medicines they're on. But
What's D3? How's that? And is it regular D3?
D3 is really the kind of medicine that's going to be, or the kind of vitamin D that's used and absorbed by your body. Yeah. But usually when you see a bottle labeled just regular vitamin D, it's usually D3, sometimes not. Sure.
Yeah.
You know, concerning that PCA, I had, like when I retired, so that's been like 3 years ago, they came to the house and the man, whoever it was, they interviewed me and everything so far. This has been like maybe going on 4 years ago. And I wanted to go to the day center or you know, or what. So he said to me that I seem to be getting along pretty well. So, but I mean, they have like a long list of before they even come out to the house, and I'm like, so I applied again, and I'm gonna see what they say this time. I would like to go to the center maybe 2 days a week, but I'm like, well, I could walk, but it's not always the great, you know, the great. And I'm like hanging on to something and get up out the chair and everything. So I said, I know they have a long waiting list, but I want to see what they say this time. But I mean, maybe that's his opinion. But if I'm like, you know, like if I'm like hanging on to something to get up, you know, I can't get up just like that and everything. I was just, you know, just trying to make a point that they have a long waiting list, PCA. I don't know if there's anything else any more reasonable. They have a real long waiting list.
Yeah. If they don't have any, you could also check the aging.pa.gov. We could think outside of the geriatric pool and just talk about groups like this. We can go to Lyme CAs. Different church groups will have different type of activities all day long. So definitely different days. The number one thing is just getting out and being active. And I know we want to be around people like us, but even if you just need to go out to the park and just like meet some new friends, I think that's the most important. If you're having trouble getting there, that's something you can also talk to your doctor about. And they definitely have like case managers and social workers and other people they can put you in contact with if you know you're having a hard time physically getting to these places.
Can I say something on that too?
Yeah.
Great. So PCA, which is the Area Agency on Aging for Philadelphia County, and and we have some resources from them up on the table here that folks can pick up at the end. They are one of the agencies that sometimes has to do the intakes to see who qualifies for what services, and there is sort of a rigid formula for that because they're getting money from the state, who are getting money from the federal government. And it is true that there is sometimes a long waiting list for that. A couple things I will say, so there are senior centers that are open that you don't need to have any qualifications for. Some of them are private, some of them are offered through the Philadelphia Corporation for Aging. So if you're looking for just somewhere to go on your own, or there are some transportation resources available, definitely look at senior centers. So that's different than something like an adult day center or something that has a more clinical level of care. So consider that with PCA. If you are having difficulties, if you think you maybe qualify for some services that PCA or a different organization doing that intake does not, it can help if you have a geriatrician or a primary care physician to go and get your doctor to document if there's some sort of issue that they think you're in need of support around, because that makes your case stronger that you're in need of that level of support.
Because I asked my case manager, she said she was going to go to the clinic with me this time from this other center, but they do have West Philadelphia Senior Center. I'll go around there sometime, or I just get together on days when I feel like myself, and I'll come to something like this, you know.
Great.
But they have a long waiting list.
All right. One other thing I'll say about PCA on that topic, and there's a brochure at the front of PCA's housing resources, is again, there's a lot of criteria that it has to qualify based on. But they do have a program really for minor home repairs. But one thing that includes is grab bars for showers, railings for stairways. You do have to be the owner of the home in order to qualify for this PCA service. But there's more information in the PCA housing brochure up in the front.
So I'm from PCA. My name's Amanda. I've been sitting here the whole time. So speaking to your, senior centers, open facilities, you can go to them whenever. You have a case manager, so it sounds like you've already had an assessment done. Yeah. So are you looking to get reassessed? Because you should be getting reassessed every 6 months.
Well, it's been a couple of years now. I had just made in my mind, well, the heck with it, I would get back to it. But I did apply again through this program to be advertised on the television. I forget what it is. It's not PCA, and she said that she was going to go through the process with me.
Okay, well, you and I can speak a little bit more about it afterwards, but just to touch, bring us back to Falls, we do have a couple of programs that are specifically focused around falls prevention, and we also have exercise programs that we run out of those senior centers. And just so you guys have an idea, we have about over 24 senior centers throughout the city, so they are available. And I do believe, if I'm not mistaken, they might even be listed in this, so they are not. But you can always call our helpline number and we can connect you to what is in your neighborhood. Because nobody wants to go all the way out to West Philly if they live in South Philly, right?
And also, just quickly, for anyone who doesn't live in Philly, I know sometimes we have people from Jersey or from the suburbs who come in. There is an area agency on aging in every area. Sometimes it's one county, sometimes it's multiple. So I encourage you to go online and find your own area on aging, and you can find it in Pennsylvania through the aging.pa.gov site.
I actually brought phone numbers for the area agencies in the surrounding counties if we do have anybody here that isn't from Philadelphia County.
By any chance, would anyone know where I can get like an eye exam so I can get me up their glasses? Because my insurance don't pay for my glasses.
Clear up their insurance doesn't pay at all. Temple?
So yeah, it's
Walmart?
that's a tough one.
Yeah.
So A lot of your doctor may be able to help you. Your primary care doctor may be able to help find you one. I also would encourage you to call your insurance and see who they would be able to pay for just a regular eye exam for. Yeah.
Yeah, but I know Walmart, they I won't say specialized, but they definitely have programs and prices for people without insurance, and I think it's like, I want to say it's between 50 and 100. It's a lot, but it's better than going to like Lens. As long as you can see, and it's better than like Lens Crafters.
And also one thing to know is that if you have an eye condition like glaucoma or cataracts, sometimes seeing an ophthalmologist who is a doctor who specializes in eyes, so a physician who specializes in eyes versus an optometrist who's an eye doctor mostly just for contacts and glasses. So they usually, insurance pays for an ophthalmologist, so a physician doctor to check your eyes. So somebody through like Will's Eye would be a good option for you, or other options. Mm-hmm. Yeah.
My ophthalmologist examines my eyes and he gives me eye tests. And I don't go to the glass store anymore to use their optician.
Right.
So you can just go to the ophthalmologist.
Yeah.
Okay. Mm-hmm.
Regarding falls, I wanted to say that you have to be cautious about the streets of Philadelphia. Because it's like landmines almost. And
Yes.
what I see in a lot of elderly people, some are very focused and they look down and they're very cautious. Others do not pay attention, and that's part of the problem. I see that when they're even going into buildings, they stop dead right in the entrance, which means somebody almost knocks them over or almost falls themselves. And the idea is to be aware of your surroundings and pay attention.
That's a really good point.
I wonder if you're looking down though, isn't there a big point of people saying to keep your head up as you're walking? That's a little, you don't know whether to keep your head down.
Yeah, it takes a lot, but you know, we have a lot of degrees of view, so hopefully you're not only seeing like one pinpoint, you can like look down for a little bit, look up, look around, just have to be willing and available.
I have a question, Dr. Reese. Maybe also pulling in Dr. Collins, who last month talked about exercise for a long time. But are there any exercises that you would recommend that could maybe help with balance or with gait, bone strength?
Yeah, for our general public, like you guys, I would definitely say like going to the YMCA, or if you don't want to do that, like going on YouTube, like looking online for different type of exercises. Like I said, Tai Chi is very good. If you like swimming, the pool is very good because support lighter on your joints. Other than that,
Yeah, any kind of weight-bearing activity tends to strengthen your bones the most. So that may not look like going and lifting, 50-pound weights in the gym. That may look more like picking up, cans that you have at home and doing, kind of general strengthening exercises. But anything that puts, that uses your muscles, so weight-bearing exercises are the best. Also, if you can find like kind of modified yoga poses can be good, and Tai Chi for sure.
Hi, I'm Liz. I'm from the nursing department here at Jefferson, and we do a lot of community outreach. So I actually have a flyer I brought with me, and we offer some free programs here. They're called Healthy Steps, or we do offer Tai Chi classes in multiple counties, so I'm not sure where everyone's from. And I'll leave it up here if you guys want to copy it down. I didn't make copies, I'm sorry. And if you guys just wanted to contact us, I have the number up here, and we can let you know when we're offering the classes. We also work with the agent.
and I can write that number up here too, so everyone won't have to like
Yeah, I know,
come
it's pretty
and
copies.
rush. It's okay.
So the flyer, you put the number up there.
Yeah. What's
Yeah.
the number?
215 503 72.
503
Yep, 72 01.
7201.
And they're all free. All free.
Here, they're here in Jefferson?
So we have a couple. I can walk around. So we have these are for 3 centers. I don't have the exact dates, but if you want to call our office.
Chestnut Market. It's not real saving, but they charge you $10 a month to use the facilities there.
He said Moss Rehab charges you $10 a month to use their facilities. So if you need a gym or something like that.
323 Randstead. It's between Market and Chestnut. It's right near the Armory.
Okay.
And it used to be the old Manor.
Oh, yeah.
Just a lot of our senior centers have gyms in them, and you can use them for free, right?
She wins.
No cost is. You might have to like have a membership fee that I'm not sure the exact details from center to center, but there are gyms that are in some of our centers that you guys can utilize for free.
If you have a Medicare Advantage plan, most of them supply silver sneakers, which get you in for free. And most community centers will use that or gyms.
There you go.
So that's an extra benefit.
Free shoes, free gym. What else we got?
It's almost like you were saying, people, when they fall down, they're too proud to even, tell the doctor or whatever. But some people, because of the fact they have a home, not to see Miss Mary's home's a mess or whatever, but some people, it got to the point that when they're falling, that they don't want to lose that home. So that home goes towards a nursing, not a nursing place, but a long-term living.
Right.
So that's why I know a couple of people who would rather tough it out and no, I don't know what's better than that. I have a friend, God bless her. She'll sit there and go to a hotel to rehab, and then she has that kind of money. Then go back to her home so they don't have to.
Like go and evaluate it and.
Yes. That's another answer for you.
Yeah, that's good. Anything else? Well, thank y'all for being so engaging with me and listening to me talk for the past hour.